Namaste, welcome back to my channel. Today let us have a small discussion on radiology audit points. In a radiology audit points, first and foremost thing we should have a SOPs. SOP in the sense standard operating procedures. There should be a written document on standard radiology procedure should be available. Standard operating process for carrying out each test procedure should be available. So, in a radiology, to perform any kind of the procedure, first and foremost thing, there should be a proper guidelines or standard operating procedure should be available to perform the procedure. The second point is, in a radiology, there should be a document on scope of radiology services shall be available. So, based on the hospital or organization services or facility, the radiology should have a documented scope of services, and the same scope of services must be displayed in the radiology, and this list should be updated from time to time. So, if the hospital or organization upgraded the services, again these services must be updated. In case some test cannot be offered or is not available, an arrangement should be there to outsource such tests. In this case, following things are required. So, if it is radiology is not having a all kind of a services, so the organization should have a MOU with other radiology. So, there should be a outsource test based on the standard process. A standard process should be there on how to outsource the test. The standard process must describe the method of patient identification, test requisition details, communication with outsource image and other relevant details. The selection of diagnostic where the test will be outsourced should be based upon criteria of quality and safety. So, whenever we are outsourcing radiology services with other outsourced diagnostic center, we must see the criteria of quality and safety, and also a written MOU should be signed with the outsourced radiology or diagnostic center specifying the terms and conditions related to quality assurance requirement. So, in a MOU there should be a written documentation with the terms and condition. The third important point is, imaging department must comply with following legal requirement: layout approval from AERB of each rooms that houses radiation emitting equipment such as X-ray and CT scan. So, there should be a legal requirement like AERB license must be available in the radiology department. And the fourth important point in a radiology audit is TLD badges. TLD badges for all staff working in radiation areas, and it should be 3 months report of TLD monitoring result. This is applicable to other area which are not within imaging department but as radiation emitting equipment like Cath lab, CM mission in OT and etc. So, there should be a validated TLD badges for all staff who work in a radiation department or radiology department, and also Cath lab and OT. And also important protective gears such as lead apron, lead sheet, etc. should be available in adequate quantity. All these lead sheets should be stored properly. They must not be folded. If you fold, definitely there will be a damages to the lead apron. So, always it has to be stored properly. The lead apron should have been checked at least once in 6 months to ensure any damages. This can be done by taking an X-ray image of lead apron and examine it. These images and the findings should be maintained as a record. So, whatever the protective gears are used in a radiology, it must be validated properly and the same document should be maintained for the audit. Each staff who works in a radiology, they should have a TLD badges and also they should wear it on duty. The TLD badges should be worn under lead apron and not over it. So, this is the poster. So, based on that, the TLD badges should be under the lead apron. So, this is the way of wearing TLD badges. A record of TLD badges been checked on periodic basis. Each staff should have been trained and are aware of radiation safety practices. Records of training evaluation to be maintained. And the fifth point is registration of all ultrasonography machines under PNDT Act. And also define turnaround time for each test. So, turnaround time should be fixed for each test and same thing should be displayed in front of the radiology and also same thing should be followed in a department. The seventh important audit point is informed consent should be taken from patient before any imaging test. So, since we are exposing or giving a radiation to the patient, so that there should be an informed consent from the patient. A documented process on handling of critical findings should be available. The document should list out findings that should be considered as critical and step-by-step process on what should be done once a critical findings is found. So, in a radiology, there should be a documented critical result findings. It should be displayed and also staff must be aware on the critical findings. Whenever the critical findings are found, immediately it must be informed to the concerned person to take a action based on a critical result. And the ninth point of a radiology audit is a declaration to be taken from pregnant lady undergoing USG ultrasound scan for non-declaration of sex. And the 10th point is each equipment in imaging should have a calibration schedule. This can be documented in the equipment log. A calibration report label on equipment should be there and evidence that calibration has been done as per the schedule. So, again equipment maintenance is very important and as per the requirement preventive and annual maintenance has to be conducted and also calibration is very important for all the equipments available in a radiology. The same documentation should be evidenced in the radiology department. And the next point is each equipment should have a preventive maintenance schedule. This can be documented in the equipment log. A record of preventive maintenance check carried out should be available. A register documenting all corrective and preventive actions taken should be available. So whenever the breakdown happens for the equipments, immediately there should be a corrective and preventive actions should be taken, and the document also should be maintained. A register documenting all corrective and preventive actions taken should be available. So all calibration report, preventive and breakdown documentation, and also annual maintenance record should be available in the radiology department. And the next point is display of a signage boards as per regulatory requirement. These include display of no sex determination, warning for pregnant ladies and small kids, warning hazards lights when radiation equipment is on, restricted entry sign at appropriate place, warning signs related to MRI. So these many displays like signage board must be displayed in front of the radiology department. The next audit point is MSDS sheet for radioactive materials should be available. MSDS in the sense material safety data sheet must be available, and also staff must be trained on MSDS. The staff should be aware of other topic which includes patient rights and responsibility, employee rights and responsibility, scope of services of hospital and of imaging department, critical findings and what to do in those situations, identification and care of vulnerable patient, occupational health hazard that they are exposed to and how to prevent, basic life support and code blue procedures, other emergency codes used in hospital such as code red, code pink, etc. So these many training topics the radiology staff must be aware, and also standard precautions for infection prevention, emergency evacuation plan, dealing with HIV positive patient and maintaining confidentiality, turnaround time and other quality indicator being used in imaging. And the main quality indicators used in our radiology is percentage of retesting required and percentage complaints to radiation safety practices. So these two quality indicator has to be performed in a radiology department. So these many audit points for the radiology department. So the staff should be trained on these many points or topic. Thank you.